Good day everyone. So today I will show you on how I perform a head and neck assessment to a client. Before performing a head and neck assessment, make sure that you perform hand hygiene, hand washing. Hair and scalp. Inspect the hair of the client. Note for quantity, length, color, distribution, and hairlines, and the character of the client's hair. Palpate the hair. Note for the texture of the hair. Examine the scalp for lumps and lesions. Examine the scalp for the presence of infections and infestation by parting the hair into several areas. The next is the scalp. Examine the scalp for the size, shape, contour, and symmetry. Palpate the scalp for nodules and depressions with fingertips. Begin palpating the scalp from frontal to occipital, then the temporal. Next is the face. Observe facial features. Inspect the eye. Note symmetry for facial movement. Ask your client to make facial movements such as, can you please smile, frown, puff out your cheeks, and wrinkle your forehead. Inspect eyebrows for hair distribution, alignment, and movement. Close your eyes. Inspect the eyelids, the upper and the lower eyelids, while the client's eyes are closed. Next is palpate the bulbar and palpebral conjunctiva. Bulbar and palpebral conjunctiva for size, symmetry, color, and texture. Palpate the nasolacrimal gland for tenderness. Palpate the nasolacrimal duct for the access of the blockage. Palpate the inside of the lower orbital rim using the tip of the index finger near the inner canthus of the eye. Test the corneal light reflex by holding a pen approximately 12 inches away from your client's face. Shine a light towards the bridge of the nose. Note that the light is reflected on both corneas. Ask the client to stare straight forward and cover the other eye and observe the movement of the uncovered eye. Inspect the cornea and the lens. Look through the pupil while shining a light on the side of the eye in an oblique view. Inspect the shape and color of the pupil. Measure the size and symmetry of the pupil. Test the client's peripheral visual fields by placing the client at a sitting position at a distance of 60 to 90 cm. Ask Next is ask your client to please cover your right eye and look directly at my nose. Okay, you may put it down. Next is, with an extended arm, hold an object. I am using a pen light. Ask your client to look directly at you. Then, ask the client to know where the first movement was seen. Front to left. The third step on the assessment of the eye is the extraocular. The first one is to instruct your client to look directly on the object you are holding. Observe the eye movement while you move the object into various points. Next is shine a pen light on the pupil to assess the location of the light reflex. Now, cover the right eye of your patient and ask her to look at the near distance. Look at my shoulder. And look at the wall. Next is the assessment of the nose. Inspect the external nose for shape, flaring, discharges, and other characteristics. Next is palpate the external nose for tenderness, mass of discoloration of the bones and the cartilage. Check the patency of the nostrils. Ask your patient to breathe in one of her nostrils. Breathe in and repeat it on the other nostrils. Tip the client's head back. Inspect the nose for eczema, excess of drainage, redness, swelling, and the growth with the use of pen light. Inspect each nostril thoroughly. Next assessment is for the ears. The first one is note the auricle, helix, tragus, and lobule. Note for the size and the position. Observe for any lesion, distribution, or discoloration. Next step is using the otoscope, inspect the external auditory of the canal for the color and any discharges. Note for color, shape, consistency of the tympanic membrane. Last assessment is the assessment for the neck. Palpate the forehead to the posterior triangle of the neck. This is for the posterior cervical lymph nodes. Next is palpate the ears from back to front, under the chin, and on the anterior triangle for the anterior cervical lymph nodes. Palpate the left and right carotid arteries. Palpate the trachea. Palpate the thyroid gland to identify thyroid enlargement, tenderness, or nodules. Ask the client to please touch your chin with your chest. Move your head sideways on both shoulders and back. This assesses the range of motion. So that is how you perform a head and neck assessment. So that is all, and thank you.